Good morning. Can you hear me? Yeah. It's a great pleasure to be here, back at home. And thank you to Mr. Menon for asking me, and also to Sunil, who has been very instrumental in this event. I'm Sakthi. I actually was born in near Erode, and then went to medical school in Coimbatore, and then worked in Kerala for nearly a year at Tata Tea, and then did my post-graduation in the National Institute of Health and Family Welfare in Delhi, and then moved to UK. Currently, I'm working as the Director of Public Health in a place called Lancashire. It's near Manchester. My job is one of the principal advisors on health and well-being to the local government, and we also commission various services, various preventative services in the main, working very, very closely with both the government as well as the health sector there. Today, I thought I'll start with just a little bit of context. I've been around from Tamil Nadu to Delhi to back to UK, and what I find is that there is a lot of commonalities. There's a lot of commonalities between UK and India, from history and everything. But also there are things that can be shared both ways. There are so many things that I think UK is starting to adopt, from the community well-being and the concept of community health workers. But also there's a lot of things that are happening back in England where there is an opportunity for us to learn from, and perhaps leapfrog and jump certain steps if we are smarter. So this is an initiative just to share knowledge and help work with colleagues who are really interested in the health and well-being of our working age people. So in my day job, I am statutorily required, legally required, to produce a report every year to the local government describing the status of health of the local population and advising what we should be doing. And this is one of my favorite lines. Essentially, the number of years one is expected to live is going up everywhere. But what we're finding is that we are living longer. We've been adding years to life, but not necessarily adding life to years. And that's the concept of living well. And I'm going to show you a slide or two where there is an emerging evidence that it's not for the sake of just better health, but it is starting to become apparent that being healthy is not just a nice thing for our families and fulfilling our lives, but it is starting to have an effect on the productivity of the economy. And that is the core sort of subject for this morning. I'm going to share some of my perspectives, mainly from England, and obviously we can't just directly lift and shift everything from England into India. And we've got a rich culture, we've got a rich history, and we've got a lot of learning just from our own history. And there is an opportunity for us to adapt and to learn from other places, and that's hopefully what you'll find in the next few minutes. This is a slide. We have data on about small geography, so below the district level here, say at a sub-center level here. So these are all, each lines are population, roughly about a sub-center population, about 3,000, 5,000. The line is the number of years one is expected to live healthily. So in England, where I'm from, it's normally around 80 years of life expectancy. But this graph is about the number of years one can expect to live in good health. And as you can see, in some places, there's only 50 years a female born today can expect to live in a good health. And that means nearly 20 years, just over 20 years of ill health before one actually passes away. So there's a lot of suffering happening. And if you start to overlay that with the retirement age there. So people are working longer, and the pension age, the state pension age, is increasing. And for our generation, it's 68 years. So people who are living in some places will be of working age, will be working till 68, but they will start to have limiting lifelong conditions from 50, sometimes even before that. And that has a direct effect on where they work as well as with their family, obviously. And that's what led me to actually stand up and start talking to business leaders and the business sector, because this isn't just about what the healthcare system can do. This is about what everybody, particularly the business sector, the industry. As Dr. Radhakrishnan was saying, if you look at what actually keeps us healthy, 80% of that is not to do with hospital care or health care. Only 20% of that is about access to really good quality health care that's affordable. Rest is all determined by your family background, where you live, how much control you have over your life, and to all the infrastructure, the education, various other things that aren't directly equated to, that are directly related to health. So that's really important, because the people that are influencing those determinants aren't health sector. And as employers, I think there is a statistic which is about a third of our life is spent at work, Dr. Gnani was saying. If we don't maximize the potential and the opportunities that is there at workplace, then we are missing out a lot. And not only that, and there is evidence, I'm going to present some of the things from England, it can actually affect your bottom line as a business. So my proposition for the rest of the talk is that in the 21st century, the workforce has become much more diverse and it's much more global than the previous era. And having a really engaged workforce is an essential component for achieving our corporate objectives, and you all know that. But what is becoming clearer is the health and well-being, the well-being of employees is becoming really, really strongly associated with employee engagement. And it works both ways. If you have a really good practice for employee engagement, the health and well-being of the staff is likely to be better, and also vice versa. But what is more interesting is, and I can see a lot of stalls at the back, there is increasing evidence of what we can actually do about it. There are lots of programs that are based on evidence, and if it's implemented in the right way, it can improve issues that we are seeing at workplace, and it can contribute to the bottom lines of organizations. So that has a direct link to what Dr. Gnani was saying about the HDI, the Human Development Index, across the country. A little bit on the global shifts. India is becoming an economic superpower across the globe. There is the shift happening in terms of the balance of the economies across the world. Technology is creating a lot of breakthroughs, but it can also be harmful if we don't control it, and if the technology starts controlling us. And all the green agenda, the climate change, people are becoming more aware, and they expect us to have a healthy relationship with our environment. And obviously urbanization, and we've heard that the health and how the health system has evolved, it has a particular focus towards urban areas, and rural is really, really important if we are to improve the whole nation. So while there are really some benefits in terms of all the global shifts, productivity has improved. There's a lot of modern working practices. Some of that you'll hear today, later. And people are becoming more autonomous. They have more control of what they want to do, because if I don't like the company I'm working in, and if somebody else is offering a better environment, I have the choice to move. But along with that, there are real challenges as well, and Dr. Gyani pointed it out too. People are starting to multitask. There's a lot of pressure in terms of delivering. Sometimes can be really, really unrealistic time pressures at work, and that leads to stress, and stress can actually kill. And that's showing up at workplace as either people don't turn up because they are ill. But I tell you what, there is another phenomenon which we call presenteeism, which is you are at work, but your performance is not at your best. It's a suboptimal performance, and that is how ill health actually shows at workplace. We don't actually see that immediately unless you are measuring productivity at work. So the number of people that are absent from work is actually less compared to people who are at work but actually not performing to their best because of health-related issues. So health-related loss of productivity is a big indicator, and I don't know how many of you have actually got the information and data for your own businesses about how much productivity you actually lose because of ill health. And that can't be just driven by, that needs HR to drive this, but it needs to be driven from the top of the organization. Just out of interest, how many of you in the room are business owners? So I can see a few hands. And how many of you are chief executives or chief operating officers? Okay, a few more, maybe one or two more. And the rest, how many of you are actually HR directors or lead for HR? Right. So that's only a few hands gone up so far. I don't know who the rest are. Are you all press people? They're also gone. The reason why I'm saying this is that without the senior level leadership commitment from the businesses, it's very hard to see this, and it's actually even harder to embed this in the culture. And somebody was mentioning earlier, UNDP, Radhakrishnan mentioned it. It is becoming really common at workplaces in England that there is set time. You can't have meetings, or you even have stand-up meetings. You have walking meetings, and the level of focus on looking after the employees' well-being has really grown in the last few years to the point that I'll come back to it in a minute. This can lead to the lost productivity and has a real cost to the business. Some of the key factors, and Dr. Sunil will go into this in a bit more detail about what we can actually do about it. And a lot of speakers, a couple of them have actually focused on this as well. Lack of sleep, mental health, particularly being stressed, musculoskeletal. You sat for long hours these days, can actually create a lot of issues and can lead to mental health issues as well. And as a whole society, there is a lot of non-communicable diseases increasing: diabetes, obesity, heart conditions. All of this can have a massive impact on not just the lives of employees, but also people who are running businesses and companies. In England, financial concerns is also an issue. People are uncertain about the economy, whether they will keep their job, and also giving unpaid care. That is probably not that much visible in India, but people provide unpaid care to their relatives, to their family members in England, and sometimes it's not possible for you to work or keep up your work. These have been studied in real detail, and I'll go on to some of the slides in the next part of the presentation. About nearly 50% of productivity loss due to health is due to mental health issues, how well you feel, anxious, depression, all of that, stress. And then over a third of that is due to musculoskeletal. So even if you focus on those two, emotional health, mental health and well-being, your wellness, as well as the musculoskeletal, your backaches in the main, those two actually can be addressed with a lot of evidence-based programs. That's what we're finding. So much so that in England, the estimates are that this £100 billion spent. This was nearly 10 years ago. About £100 billion was spent on sickness, absence, and worklessness associated with ill health, and that is more than the budget for the NHS, budget for the National Health Service. Actually, it's about the same size of the entire GDP of Portugal, what the entire nation's productivity, the GDP, is how much is being estimated as lost due to ill health. And mental health particularly accounts for 15 billion. But as a business, as a corporate, in the industry, it's really, really important not just to understand that, but without that being linked to the productivity, it's really, really crucial to do that. Otherwise, what is in it for the industry? What's in it for the leaders? Especially if you're running a commercial one, but not just commercial, even for the other sectors. That tool set, that toolkit about understanding how you go about measuring that is becoming more prominent in various sectors. And there are tools, there are validated tools for us to actually estimate the loss of productivity. And I would strongly recommend you to consider doing that, or consider how you may want to approach that subject. If you're running a business, how will you know how much productivity is being lost because people are stressed, for instance? And this is what's happening in the UK. There is a lot of sectors, not just health sector. There's transport for London. They run the public transport in London, the rails, the buses and all that. They've found people who are obese, so with a BMI over 30 compared to BMI over 35, there is twice ill health related loss of productivity in the work. There's so many examples in the NHS organizations of staff well-being programs. That's Dr. Sunil will go into that in a bit more detail. This is also now becoming all standardized with some standards. We have something called the Workplace Wellbeing Charter, which was developed in partnership with industry, where there are various domains and there are standards. You can assess yourselves as a business, and that's the initiative that Mr. Menon and I, and with Dr. Sunil, we want to see what is the potential for us to do that in an Indian context. So there's a lot of support available from other places that we can learn from and adapt in our setting. One of the really well-developed pieces of work in Britain is this initiative called Britain's Healthiest Workplace. It's a partnership between the insurance companies and some of the think tanks and the University of Cambridge. This started about 5 years ago. So this is a fairly increasingly well understood area in the business sector. Increasingly measuring how well our employees are, what are the opportunities to short term. It's not all long term. There are obviously longer term benefits, but it is about understanding the return on the short term basis. So that's increasingly being developed, and it's a good source of information to actually look at, and that's some of the things that we are actually in discussions to explore further. It is applied to all sectors. So what they do, they have a survey and they assess how well your employees are, and there is again some standards, and they basically, it's now run as a competition, but it didn't start as a competition, but they give awards to small businesses, medium-sized businesses, large companies, and as you can see, there are some well-known ones here. And it's all the sector. It's not just within the health sector. They have the Britain's healthiest workplace. They have the Britain's most improved workplace compared to the previous years, as well as the new entrants. So it's becoming a trend in Britain that more and more companies are starting to think, because it adds to their credentials in the market. So that's some of the slides, and there's only a few more, and I'm happy to stop after that. The results are quite stark. About 11% of the working hours are lost. That's a significant amount of working hours lost due to ill health, and most of that is not due to absenteeism. Most of it is due to presenteeism. People are at work, but they have got other issues going on, and if you don't address it, that's the opportunity that's lost. It is obviously highest in the wholesale and retail sector, and the next in the education sector. So that's the level of insight the Britain's Healthiest Workplace initiatives found. Work engagement, very, very low. 17% of the respondents, very low work engagement. So it's really important that if we are delivering programs, wellness programs, you've got to engage your employees, and it's also becoming apparent that you've got to engage their families as well, and not just the employees. And given the young population here in the workforce, they are really less engaged, and many of them have reported very fatigued and tired, basically. Employees who are able to work flexible hours, I'm not sure how prevalent this is here, but employees who have flexible working hours do more physical activity and therefore feel less fatigue than those who don't. So as a policy management practice, flexible hours working, there is a lot of experience in the UK. Mental health, I've talked a lot about mental health, particularly affecting younger workforce, and financial concerns is particularly an issue for younger people in a UK context, and there may be a difference in an Indian context. 72% of employees with a lot of financial concerns suffer from work-related stress compared to the average, which is 54%. So that is of significant interest for me in a UK context, and this is something I'll be interested to know what you find here in an Indian context. Physical activity and lifestyle. It is an increasingly common to have non-communicable diseases, heart disease, asthma, arthritis, rheumatoid arthritis in particular, lack of sleep, but even more, lack of quality sleep. 40% reported that their quality of sleep is not good. Sleep less than 6 hours, they lose more than twice as many working hours due to absence and presenteeism than who sleep. I'm not suggesting we all sleep for 9-10 hours a day, but it is the quality of sleep is really important. This one, 5 times more likely to suffer from depression if the quality of sleep is not good compared to the controls. So that is some of the data. There's an increasing availability of data as well. And again, I was doing some research here in an Indian context. There is a lack of information, or at least it's not available in the public domain. But as business leaders, as businesses, I would strongly recommend you to consider what that might be that you want to collect in your workplace. Okay, so what works? There is increasingly a lot of evidence-based programs that have been shown to actually work, reduce stress, and here we have some solutions in the room as well. But the place to start is not fruits and Pilates and yoga. The place to start is the commitment from the board level, really at the top of the organization. Otherwise, this will fizzle away. This will just disappear as a small project, and the businesses won't see the benefit of it. And that's, again, There's a lot of good practices available even within India, but also in the UK. But that's where I would start. Significant board level commitment will have a greater impact than individual schemes. There are various schemes like we have here, well managed and well coordinated. The uptake of those schemes and the coverage of those schemes within the employees can improve, and they range from physical health checks to discounts and gym sessions and yoga. All these things we have lined up today with some very eminent speakers for the day. So hope you will get a lot out of that. Everything leads to culture, how we relate to each other, respect, respect for time in particular, are some of the key things in the schemes, and Dr. Sunil will also go into some of that detail. Board level commitment, extending it to families, supporting participation during work. Dr. Yanni mentioned it, Saturday seminars. That is not supporting an environment. That is not an environment where you actually support people in work. So there is something to consider about how much do we value people to be supported during work, and also getting ideas from employees. Don't just lift and shift from UK or from one company to the other. Every place is unique, and every place has got its own culture, and and every place is different. If you go from Chennai to Erode or to Cochin, it is different in different places, and that has to be embedded, and employees have their own ideas as well. So we've started to develop this as a framework. So how do we go about it? And there are lots of standards that we are adapting to an Indian context. If you put employee well-being at the center, you need to know what you actually are measuring. What is employee well-being? How do you measure it? Board level commitment is a really, really important starting point. Without that, I would recommend we don't start. But we can explore and support the board leaders, the organizational leaders, with various tools in a fairly straightforward, timely way to do that. Policies, there is a suite of policies that is available from the healthiest workplaces in Britain and in India. There are a lot of examples to share and learn and, between organizations. The well-being schemes have got a really crucial role because that's the content. Without high quality content, this will not have its desired effect. And then an evaluative culture, by that I mean constantly measuring, are we going in the right direction? Is it having an impact on productivity or absence or the bottom lines? All those things. If we say people are our assets, those metrics should show on the balance sheets along with the money, and that's my argument. So there is an emerging framework. Normally, what we do back in England is that we take a staged approach. We start with diagnostics, like we do for the individuals. We do that with organizations. Is the organization ready? Do you have the foundation to start off? Do you have a culture of employee engagement? And then it's tailored to each company, each sector. There will be particular issues, manufacturing sector, particular issues in the IT sector. And the schemes have a really crucial role. Some of that you're going to hear today during the course of this workshop. And then the implementation has to be carefully done. Having really good employee engagement doesn't really equate to increased employee well-being or reduction in the loss of productivity. It can be all a feel-good factor, and that may not lead to what you're really setting off to do. So it's really, really important to actually identify why we want our employees to be healthy and well, and the quality of the content, whether it's yoga, the gym sessions, or lifestyle support, right up to if you are running health checks at workplaces, the quality of care that should follow after that is really important. And one of the things that we are considering is to develop a community of practice, a network, so that if you're part of the network, you get to learn from each other in a safe environment that can share good practices, but also start to lead the way in India. This hasn't happened yet. and there is a potential for those of you in the room to be the leaders in your respective sector, and there is support and guidance that we are prepared to provide to yourselves. That is a sort of a quick tour of what we are doing, what kind of things work, why it is important, and some of the things that's available in terms of the support and guidance for various sectors. I think that brings my presentation to an end. Thank you.